Welcome to the Sunshine Coast. The sun was out, but it's gone now. Our region starts, I don't know, do you know Sunshine Coast very well? Yeah, our region starts around about Caboolture and the Red Cliff Peninsula and goes right up to Gympie. Just some unique features. We've got 1 in 4 people aged over 65 in our region compared to 1 in 7 for the rest of Australia. And we've had a number of large hospital infrastructure projects go on in our region very recently. One of the hospitals opened up at the end of last year and another one's soon to be completely online by 2016. So we are expecting some particular workforce challenges in the next little bit with people running away and going across to health. In terms of how our region came up with the priorities for our regional projects, we had a facilitated workshop back in July last year, and it was identified that there were 2 really important themes that the IRG felt that we needed to prioritise to support our local providers. The first was actually around the new financial changes to aged care, be it home care or residential, and what that meant for frontline staff, as well as what had to happen in the back of house to get systems and processes sorted out with all of the changes to legislation. So what we went about doing there was there was an off-the-shelf program that Lorraine Pullis put together for budgeting for consumer-directed care, and we brought her up to Queensland because she's based in Melbourne. We brought her up to Queensland and we subsidised the cost of her program for providers in our region. But we partnered with Laser Queensland to do that, and so what that meant was our project paid for Lorraine's travel and accommodation expenses, but she ran the workshop in Brisbane for them one day and then came up to the Sunshine Coast and ran it for the second day. So instead of just helping our providers, we were actually able to get about 40 providers through that training program over the 2 days. And she is a consultant, she's an independent consultant, but she actually sits in and does the ACAR reviews with the department. And she's running a workshop. Where are you from? Melbourne. She's actually running a workshop in Sydney, but she's based in Melbourne, so you can probably get the workshop on the ACAR, on writing your ACAR applications. She's doing it next week down here. Yeah. So, Poulos.
Give me details?
Yeah, now Matt, I will. Yes, I can get you the details, no problem. The second piece of work we did was with Bentley's, and Peter was actually involved in working with me in that. So Peter's from Bentley's. And what we did with Bentley's was we asked them to put together a custom-built program for us. The first half of the day was really to help intake staff understand the changes that were coming, because there'd been no education to them about income and asset testing and what that meant for residential new entrants from 1 July. And then the last part of the day was Bentley's have developed a very comprehensive package that providers can buy to help them with their accommodation pricing, but they gave us a modified version of it in the afternoon to help providers do their accommodation pricing. Our issue probably with all of that was when we ran the workshop, the pricing guidelines hadn't been finalised, and we knew that was a risk, but we thought that the government might have resolved it by the time we did the delivery. So that meant there was a level of uncertainty still about whether what we were delivering was really what was going to be needed. So that's a learning, but we didn't want to wait either, because there was a lot of work for providers to do to get to that point. So the second project and the biggest piece of work that we're doing is around technology for our region. And the priority there is the fact that we are a geographically dispersed region. We've got 5 local government areas. We don't have good IT infrastructure from the government or Telstra's point of view. So we've only got NBN in a couple of tiny new estate developments, but we're not on the NBN radar till well after 2016. But we've got providers who want to use technology to manage workforce, use technology with their clients to actually improve wellness and reablement for them. So the idea came about that we'd hold a summit to see what we could do as a collaboration in the region to actually become a stronger voice, to lobby the Telstras of the world, to lobby local government and others to actually support us in more IT infrastructure. But out of that too, there's also opportunity for leveraging licence fees and all of that sort of stuff as collaborative voice to say to software developers, well, know if 10 of us in this region come in together, you've got to be able to do a better price for us. So it's about that collective purchasing power. So we held a summit at the end of February, bringing together health and aged services, because health actually get a fair bit of attention from our local council, and aged care haven't been at the table. So we brought health providers, aged service providers, and we decided to open it to disability to come along and tell us about what we could potentially do. So the little slide down the bottom are the 4 draft actions that have come out of that summit. So they are to have a strategic thinking group who might come together and actually work on lobbying. So influential people, movers and shakers who can actually get the attention of politicians and other people. Have a community of practice develop of people who want to actually work together on collaborative ideas and projects and actually move them forward. We're lucky our Regional Development Australia have actually picked up those 2 actions and are going to facilitate that first process, and of the community of practice they actually have money to develop a portal so we can have an online conversation, but they've taken it more broadly. It's every business in the Sunshine Coast, which I think is good for us anyway because they're our supply chain, and we do the Sunshine Coast is really big on promoting buying local, staying local. So fruit and veggie shops, butchers, bakers, they all supply services to us or to our clients, so it's about actually supporting all of those businesses to be sustainable. The third action out of our action plan, we're hoping to develop an IT strategic tool. That means the provider can actually do an audit on themselves to actually see what they have and what they don't have. For our region, that's about getting a collective picture too of what we need so that we can inform some other projects. All of this part's culminating, that stuff won't all happen here. The action plan was actually to help inform where we might go into the future and what my IRG might take on as ongoing priorities and projects. So the celebration of the end of this particular technology activity is having the summit. The summit's going to be held up on the coast at Caloundra on the 19th of May. It's a Monday, so if you want to come, you can come for the weekend and stay. What we're aiming to do with that technology is we want to bring infrastructure providers together. We're wanting to bring people who are doing research in the latest and greatest in assistive and adaptive technologies from the universities, and they've all very generously donated their time. We're just covering their travel and accommodation expenses, which is fabulous. And they're doing things like using Xbox gaming technology in stroke rehabilitation and things like that. So it's actually showcasing the latest of what's happening in the research space in Australia and getting that to our providers, and also the opportunity to buy into those research projects and actually become a part of the research with your clients as it's being rolled out, which is great. We've got local government talking, we've got RDA coming and talking, because there's a bit of a regional flavour there, but the expo that goes along with it, the trade exhibitors are actually showcasing everything that might be being spoken about and thought about. So this is our preliminary program. There's a few things that we've still got to tweak and have confirmed, but you're almost welcome to attend. It's a bargain price of $165 only, and your travel and accommodation, of course. So that's our network. We've been pretty busy, but I've got a really proactive IRG. What's probably a little bit different about my reference group is from the beginning I included Medicare locals. So I've got both Medicare locals and I've got a Regional Development Australia representative on our group as well, because they have connections and opportunities. And so we didn't want to duplicate, because there's been a lot of duplication go on across certain activities, and we didn't want to duplicate anything. We just wanted to leverage off existing networks and other activities. So Medicare Local are supportive in being part of this strategic sort of thinking group as well, and what we might be able to do in the region. So
that's a great program.
Thank you. Glenn Bunny, who is my lead, I don't know if any of you know Glenn. So Glenn is on the Laser Queensland board. He's also on the national board for Laser Queensland, but he's actually also on the board of the Aged Care IT, whatever they're called, ATIC, Aged Care Technology IT something or other. So Glenn is the lead for this project. He works in our region. He's got his businesses in our region, which is really lucky for us, because it means he's at the forefront of a lot of this stuff, and he is really proud of the program and thinks that we've got something that's worth coming along to. But it's important for us to do something economical for the providers in our region, and to go to some of the other technology conferences that are on. They're not necessarily just about health and aged care, they're technology everything, and they cost thousands of dollars just to
actually look at the introduction of technology into the home for carers and clients.
Yeah. That's what most of this section here is really about. So the e-health stuff's a bit tricky. This hasn't been confirmed because they're under review at the moment. They won't send anyone out to us, but our local Medicare local are pushing it, so they'll probably do that presentation. But this lady's now confirmed, Stuart Smith's confirmed, and Glenn, that's it. The Aged Care Industry Information Technology Council.